All right, so what we're gonna do is work on internal rotation of the hip in a 90-90 position. So to get in 90-90 position, basically we're gonna stack our spine over our hip and pelvis. Here's your ASIS. You're gonna use that as your landmark, pointing out this way, lining up your front knee. Your knee is gonna come out 90 degrees to your foot and ankle. And then, this back leg is gonna come out 90 degrees from your pelvis. You're lining up your foot and ankle to the knee and then to the back leg. So it's creating this nice straight line. So for us, we're working on this leg to create internal rotation of the hip. You have a couple of options. You can rotate and kind of anchor yourself this way as far as you can go, or you can lean back and kind of close down that angle. Whichever one's more comfortable for you is what you're gonna go for. So, you just gotta find the way that you can close this angle out. So what we're gonna do is we're gonna hold this position for 2 minutes. After 2 minutes, we're gonna initiate our contract and relax, but before that time, we're gonna breathe diaphragmatically, rest and digest, in through our nose, out through our mouth. That way tissues have a chance to elongate. Now after the 2 minutes, I'm gonna do the contraction. So if I imagine that there's a scale underneath my knee and my ankle, the first thing I'm gonna do is I'm gonna have everything on this inside basically push down into the floor because I'm trying to add weight onto the scales. So I've stretched out all that tissue. Now I'm ramping pressure down onto the scales, pushing down as hard as I can. And I might even, get really tight from my back, my lats. I might screw my hands into the ground to get a little bit of extra pressure. But the idea is I'm adding weight, ramping up, for 30 seconds, and then I'm gonna ramp back down to 0 to relax. Now the second contraction is coming from this side, and those same scales, I'm thinking of weight coming off the scale. So, what I'm basically doing is I'm getting tight again and I'm lifting as hard as I can, everything from my spine, my lats, my back, my hip, the glutes, everything's lifting my leg up off the ground, but I'm already at in range. So that foot's not coming off the ground. I'm just trying to take weight off the scale, zero it out. I'm gonna do that for 30 seconds, as high intensity as you can manage, and then you're gonna ramp back down to 0 and then relax.